Trying to figure out menopause treatment can feel, well, pretty overwhelming, right? But the science has actually gotten so much clearer recently. We now have really effective, evidence-backed ways to manage symptoms. So let's jump right in and see what the latest research has to say. And if you are feeling confused by all the different treatments for menopause, yeah, you are definitely not alone. I mean, it can feel totally overwhelming with all the conflicting info out there. But the good news? We finally have some really solid data to help cut through all that noise. Okay, so here's what we're going to do. We are going to break down the 3 leading strategies. And this is all based on the very latest 2023 guidelines. We'll look at hormone therapy, non-hormonal meds, and something called cognitive behavioral therapy, and really dig into what the science says about each one. Right, so before we jump into the solutions, let's just quickly set the stage. Because menopause, it's way more than just hot flashes. It's a whole collection of things, a complex set of symptoms that these therapies are designed to fix. You can pretty much group the biggest symptoms into 3 main buckets. First, you've got what doctors call vasomotor symptoms, or VMS for short. That's the classic stuff, hot flashes and night sweats. Then there are the psychological symptoms. Think anxiety, mood swings, not being able to sleep. And finally, something called genitourinary syndrome, or GSM, and that's all about vaginal and urinary health issues. Okay, let's kick things off with the big one, the gold standard, hormone therapy, or HRT. According to, well, pretty much all the major medical guidelines, this is still the single most powerful, most effective tool we have for tackling those really disruptive menopause symptoms. And when I say effective, I mean, wow, the numbers are just staggering. We're talking about HRT cutting the number of intense hot flashes by anywhere from 50 to a full 100%. Seriously, nothing else even comes close to that kind of power when it comes to those vasomotor symptoms. But, okay, let's talk about the elephant in the room, the risks. You can't talk about HRT without talking about the risks. I know there's a lot of fear out there, mostly from some really old studies. The good news is, modern science has given us a much, much clearer picture of who should use it, when they should start, and how to do it safely to minimize those risks. And that brings us to this absolutely crucial idea called the window of opportunity. The research here is crystal clear. There is a sweet spot for starting HRT. It's between the ages of 50 and 59, or basically within 10 years of your last period. If you start then, the benefits, especially for your heart, just far outweigh the risks for most people. And how significant are we talking? Get this. Studies found that women who started HRT inside that window actually had a 31% lower risk of dying from any cause. That's huge. It shows just how powerful a protective effect it can have when you get the timing right. And here's another key thing. How you take it matters a lot. See, if you take an oral estrogen pill, it has to go through your liver, and that bumps up the risk for blood clots. But, and this is a game changer, if you use a patch on your skin, the estrogen goes right into your system, totally bypassing the liver. It's just a much safer way to go from a cardiovascular perspective. Okay, but what about the big one? Breast cancer. Yes, the data does show a slightly higher risk with combination HRT. But here is the part that everyone misses, and it is so important. That risk is not permanent. Once you stop the therapy, your risk level usually goes right back to normal within just a few years, like 2 to 4 years later. Now, look, HRT isn't the right answer for everybody. For some women, it's just not an option, maybe because of a past history of breast cancer. And for others, it's just a personal choice. So what else is out there? Let's dive into the non-hormonal paths. Okay, this chart really tells the story, doesn't it? When you're just talking about raw power, about stopping the sheer number of hot flashes, HRT is just in a league of its own. You see, antidepressants can get you about a 35% reduction, and cognitive behavioral therapy, or CBT, is around 25%. But, and this is a big but, just counting hot flashes isn't the whole story. And this is where things get really fascinating. Even though CBT technically reduces the number of hot flashes less, 40% more women who try it say they feel significantly better. So what gives? Well, CBT is different. It's not just about stopping the hot flash, it's about changing how you react to it. It dials down the distress and the anxiety it causes, which really puts you back in control. So where do those antidepressants, the SSRIs and SNRIs, fit into this puzzle? Well, they have a very specific sweet spot. They're a fantastic choice for women who are dealing with both moderate hot flashes and things like anxiety or depression.
It's kind of like a two-for-one deal. One medication to tackle both the physical and the psychological symptoms at the same time.
And if you're wondering what on earth is cognitive behavioral therapy, it's actually super practical. It's really a two-step process. First, you learn to catch those automatic negative thoughts you have when a symptom hits. That voice that says, "Oh no, everyone's looking at me," during a hot flash. Then, step 2 is all about learning new ways to respond, new coping skills, to basically break that cycle of panic and distress.
Okay, so there you have it. 3 really solid evidence-backed options. The big question now is, how do you figure out which one, or which combination, is the right fit for you? This table breaks down the trade-offs really well. With HRT, you're weighing some rare but potentially serious long-term risks. On the other hand, with SSRIs, the side effects are way more common and happen right away. We're talking nausea, sexual side effects, but they're usually not as severe. And then you have CBT, which is kind of in its own lane with, no physical side effects at all.
Let's just zoom in on that SSRI column for a second, because this is a really important trade-off. They're a great non-hormonal option for sure, but the side effects can be a real issue. About 1 in 4 people get nausea, and loss of libido is pretty common too. And those things can have a huge impact on your quality of life. It's actually why a lot of people end up stopping them.
So let's try to put this all together into a kind of simple decision-making map. If your biggest problem is severe hot flashes, and you're a good candidate for it, HRT is the #1 first-line choice. Simple as that. Now, if HRT is off the table for some reason, then you'd look at things like SSRIs for those hot flashes. But, and this is key, if your main struggle is more psychological, like anxiety or you just can't sleep, then CBT is actually considered the first and best place to start.
At the end of the day, though, this isn't a one-size-fits-all thing. The perfect choice for you is going to come out of a conversation with your doctor. It's all about balancing these different factors: how bad your symptoms are, what your personal health history looks like, what side effects you're willing to put up with, and frankly, what just feels right to you. So the science has laid out a really clear menu of options for us, right? Each one has its own list of pros and cons. The real power now is in your hands, knowing what questions to ask and knowing what's most important to you. So the real question to leave you with is this: what is your priority in navigating this next chapter?